Maya, thank you so much for coming and for helping us teach people how to write grants.
Oh, of course. I'm so excited.
Yeah. Our goal is to help people be able to get external funding, which is how you get paid to do research. And so as an early career researcher, you just wrote your first major career development award, and you've written a number of other grants. Can you tell me what kind of grants you go for and how you judge whether you should go for a federal grant or a foundation grant?
Yeah, so I just wrote my first K, which was very exciting. I submitted a few months ago. But before that, I wrote a few other smaller grants. And I actually thought that that was very helpful to have as a track record when I did apply for my Career Development Award. So I started off with a small pilot grant through the university, and generally I find those are a bit easier to get because there are people within your institution who have gotten them that you could get examples from. And then they're smaller amounts, and they're geared towards early career researchers. So it's exactly what I was looking for. The second grant that I applied for was through the Emergency Medicine Foundation. And the beauty there was that they had a grant that was specifically on my topic. So it was emergency researchers who were doing firearm injury prevention research.
And when there you go.
There you go. You find something that's so niche, and I couldn't not apply for it. Because you know that the pool is going to be smaller and you know that your chances are so much better. And again, getting that smaller grant really gives you a track record and shows commitment to the topic. And so that's how I chose going for those two smaller grants and the foundation grant and the university grant before going for the Career Development Award.
And then how did those play into was each grant bigger than the prior grant? How did you roll it to the next grant?
Yeah, so the pilot grant through the internal pilot grant was the smallest grant.
Do you remember how much was that?
That was $30,000.
In 1 year? Or
$30,000 over 1 year with a no-cost extension for a second year.
Okay.
And I applied for that in the fall, probably September. And then the next grant proposal was due in January or February, and I hadn't heard about either of them yet. And so I put it in thinking it's a bigger grant. It was $75,000 and an institutional grant. But I said, I need something to go. And then I got them both, and I was terrified. But I managed to complete both of them, and the beauty was that then I managed to finish both the projects, have some publications, and show follow-through for when I wrote my Career Development Award, which was an amazing thing to have, and I think a perfect track of just getting some small things done first.
So you're just describing, first of all, congratulations. You're describing a number of funded opportunities that you won, and you completed them and created some products of scholarship in the peer-reviewed literature, and then you take that to apply, and suddenly you have a track record and you have findable products of scholarship, and you've shown that you can successfully lead a project from beginning to completion. So those are such a great windfall for then applying to a bigger grant.
Yeah, and I think that was huge, was not just showing that I could get a grant, but making sure that I demonstrate that when I do get a grant, I finish it.
Yes.
And I have a publication. Because I actually think it might have showed very poorly to show that I got a grant 3 years ago and I still haven't written it up. I think that would have probably been problematic. So having those kind of reasonably sized products, reasonably sized projects, so that I can have that product of scholarship for when I submit my bigger grant.
Yes, unfortunately, we know many people who were in that situation where they had a grant. It was a wonderful opportunity, and COVID hit for many people. That really messed up their ability to progress. And then they find themselves 2 or 3 years later trying to go back for more, and they really don't have something accomplished that they can show. It's how you take a real positive actually to a negative. So now you have proof that you got a grant and it did not get completed, and you do not want to report about that. I mean, you got to find a way to get a paper. You got to do something to get something out of that product, even if it's not what you wanted.
Absolutely. And my grant was actually during COVID. So our second period of recruitment completely failed. We recruited the number of people we wanted to in the first group, and in the second group, we only got 54 participants. I think we wanted 125. And at some point, I said, let's keep recruiting. And at some point, my mentor said, you need to stop now. And that was great because I said, okay, we're going to stop recruiting and we're going to write this paper and it will find a home. And I think you've told me that every paper has a home, but every paper has a home. It's not perfect and it might not be the highest impact journal, but you have to get your research out there and you have to move on.
That is a wonderful reflection. You know, there is a time in your career where quantity is more important than quality when it comes to manuscripts. Not to say you're going to put out poor quality, but I mean from the outlet perspective. You don't have to shoot for the biggest national journal with the biggest impact factor. You just need papers. Right. And you don't have to do the whole ball of wax, so to speak, on your project. You can like take little pieces and submit brief reports or small cases or whatever to a number. You just need to get your name out, and you need to get a track record and frankly a little bit of practice submitting.
Yeah, and also what you have might be good even if it isn't exactly perfect or exactly what you planned. So it's just letting go of this ideal image you have of what you wanted to submit and saying, I still have some good product here. There is still something valuable, and just knowing when to move to the next thing.
Very true. Okay, let's talk about timelines for submission. So you talked about when you had your 2 pilots going, you had to submit them both not knowing what would happen. Mm-hmm. And then have you come up with situations where there's not enough hours in the day to do them both at the same time, so you sort of make a choice which thing you're going to do? Have you faced that?
Well, I have, because those were similar projects. So I did have to put one on hold for 6 months so that I could start the other. And that was really a discussion with the funders and with my mentors of how to manage that situation. There was some overlap, so I was able to use the same participants for both projects for a few of the participants. But I did have to pause, not because I didn't have enough hours in the day, but because the recruitment for both would have been very similar.
Interesting.
Yeah.
Okay, good. But you went to people who knew what they were doing to get advice on how to bring that conversation forward. You didn't just get on the phone with somebody.
I go to my mentors for everything.
Okay. Well, now let's talk about your mentors, because you're in pediatric emergency medicine. Mm-hmm. You study firearms and suicide. So I'd imagine you have a multidisciplinary team. When you first started getting interested in research, how did you find your mentors, and how have you continued to refine the mentorship team that your funders want you to have?
Yeah. So I struggled. That's how I found my mentors. I had a wonderful mentor in pediatric emergency medicine who was an epidemiologist in pneumonia research, which had nothing to do with what I'm doing, but she's a very strong researcher. And she knew that she did not have the background to mentor me in my content area. And there weren't really a whole lot of people who did what I wanted to do, let alone in the pediatric emergency department. So we started off with those smaller grants with this first mentor, and we were successful. As I gained more direction, I think people were more willing to support me. I think it was hard at the beginning because I knew I wanted to solve the entire problem of firearm injuries, but that didn't seem realistic to people. But once I was a little bit more directed, I was able to find the right people. So just having those first meetings with people, telling them what I was interested in, but also telling them what I'm interested in and what my career plan is. So I'm interested in firearms and youth suicide. I want to write a career development award within 1.5 years or 2 years, and then I'm going to be an independent investigator. And I think just having that mindset also makes it more attractive to a mentor because they know that I'm going to move forward and their time won't be wasted.
In suicide, there's the whole psychiatry, psychology field. There's obviously the injury and illness field, which you're in, and the pediatric piece. Mm-hmm. Did you have to find mentors in every one of those sub-areas?
So I did diversify some, and I think it also depends to some extent where you're going with it. Initially, on those first smaller grants, my mentors, as I said, was a PhD epidemiologist who's expert in clinical trials, and then someone from the adult emergency department who does firearms and suicide. And then there was that question of, well, on one of the grants I didn't get, it was a question of, she doesn't have that youth suicide piece. And conveniently, I applied and got rejected from another grant. We should talk about those too. And they invited us to a conference to learn how to reapply and how to submit a successful grant. And I met a child psychiatrist there who seemed very interested in my work. And she said she wanted to help me. And she has been immensely helpful. And so I think just having those communications, those contacts, constantly networking has been really helpful.
That's very helpful. And what a great silver lining to a grant rejection. Certainly you didn't think that would happen, but to get invited by a funder you want to be funded by to a special program for how to write grants to them, and then finding a very ideal specialty mentor, sounds very positive.
Oh, it was very positive. And then also, as I've been writing grants more frequently, I think I identify the pieces a bit better where I need help. So those first grants, I just knew I needed mentorship. And now, as I was writing my career development award and I was developing my aims, I realized I'm doing a pilot grant and I need to do a pilot study, and I don't know how to do dissemination and implementation, and now I need to find that person. So as I was refining my aims and refining my training aims, I just got better at understanding what kind of mentorship I needed. And I think that will also translate, I think you could tell me in the future, into team science, because I will never know everything. And so as I progress and become an independent researcher, I imagine there are still pieces that I'll need support in. And I think that's how I'm going to identify people on my team then too.
Yes, that's exactly right. They won't come in as a mentor per se, as the one who knows and you're the learner. Instead, you'll be the expert in your area, they're the expert in their area, and together you're going to bring the perfect team. Yeah, that's awesome. Okay, let's shift, because you brought it up, to bridge over to, if you're submitting a bunch of grants, you're getting rejected, because that's the game. Most people don't get grants the first time. So tell me how you manage rejection and sort of prepare to respond with a resubmission.
Yeah, so I got my first 2 grants. I thought I would never get rejected. I thought I'd beat that. I was then rejected on a letter of intent for a small grant, and then 2 more grants after that. And the first time you could say, okay, that was a one-off, and then you start getting rejected, and it's very demoralizing. And so things that have been really helpful is just talking to others, because you realize that everyone gets rejected. And all you ever hear about is these great successes, which I do want to hear about, but you don't know that most of the grants they applied for, they're not receiving. And so that is really helpful, just to start off by normalizing it, that it's just part of the process. I think the first thing I do is read the comments and then put them away for a week, and then go back to them. And I think it's really often been very good advice. So the American Foundation for Suicide Prevention grant, for example, it was such constructive, useful advice and things that I've carried forward into my future grants, because they all made sense as criticisms. And then preparing to resubmit, I just went through all the questions and made little notes. And then as I wrote them up, spoke to different experts that are mentoring me and different people that I'm in contact with, and just checked in. And does this make sense as a solution? Or spoke to people if I didn't have the answer and tried to ask for advice. So again, just going back to people who know, or also sometimes it was because I didn't explain well. Sometimes
Occasionally.
Sometimes I wrote this, but I clearly didn't explain it well. I think also shifting from that mentality of they didn't understand and getting upset to, if they didn't understand, I didn't explain it. And that's okay. And so just going with that mentality of this is just to improve and to make the project better and to be better for the patients is really heartening for me.
So you talked about when you got your comments or you got your score, it was demoralizing. Mm-hmm. How do you, and you put it away for a week, do you have to talk yourself out of it? Like, what is does time just heal? Or do you have to do some things to get into the right framework before you sort of go at it logically?
I think if I talk to my friend and mentor. And as soon as I talk to one person and realize how normal it is and how common it is, that just puts the angst away. Because it's not me being rejected, it's not my project being rejected, and it's not personal. It's the way something was written or how it was explained. And so having that conversation with other people who have been through the same thing is just so helpful and just allows me to move past it and get over myself and start writing again.
Tell me about your writing process, because you've put in a number of grants, so you must be able to move things forward, and you've gotten a number of peer-reviewed publications. Congratulations.
Thank you.
How do you move your writing forward?
So one of the most useful things I've done is join a scholarly writing group, and we meet every Friday from 9 to 11 unless I have a shift, and that just gives me 2 or 3 hours where I'm sitting down and writing no matter what. I don't book meetings, I don't book anything else, and that is really my protected time to write. The beauty of that is that I know in 3 hours I'm not going to write a whole paper, but I could write a method section, or I could write a result section. And so it really sets me down to focus at that time. I think the other thing is knowing that I'm not sitting down to write a paper. Sitting down to write a paper is daunting.
Yes, it's too big.
Sitting down to write a method section is not daunting.
Right, it's
Sitting down
intuitive.
and deciding that I'm going to write a patient characteristics section is not daunting. And so, but then they come together.
Okay, so let me ask you a couple questions then. Do you plan for that block which section you're going to write in advance, or it sounds like having it in a bite-sized chunk helps, but how do you know which one you're going to allocate for which block?
I plan in advance. This Friday, I am just writing a method section. And that makes it easier for me. I have one paper that I was dreading writing. It was just the project went sideways from the beginning, all these unexpected problems with the project. But I knew that, as we said before, it wasn't perfect, but it had to get published. I had to write it up. And the idea of writing it up was so daunting. And so I said, this Friday at SWAG, I'm just going to write the method section because that's easy. That's just what we did. And then week after week, the next week I said, I'm just writing an introduction section. That's it. And 3 weeks later, I went to write something and I realized that I had finished the entire paper. I was shocked. So I really think breaking it down into those bite-sized pieces makes it so much easier to actually get things done.
Okay, that's awesome. Now tell me more about this group. How many people, is it in person in a room, or are you in your own offices but on a Zoom call? How does it work?
I've tried to do it on Zoom calls. It hasn't been as productive.
Okay, interesting.
We meet in person for 2 or 3 hours every single week. We meet at a coffee shop. We have a different coffee shop every week. And right at the beginning, everyone tells us what their goals are. We kind of say what we're each going to work on, what we're going to finish in that 2 hours. And then we go, we work, and at the end, we kind of talk about what we have done. And that's it. Everyone goes home.
That sounds so fun.
It's so fun and so productive.
How many people?
So there are a lot of people on the list. We're probably between 3 and a most of 8 people a week. I would say on an average week, we're about 5 or 6 people.
Okay. And you rotate around. Do you all sit physically together, or you disperse among the coffee patrons?
We all sit together. Somehow we all find a big table together. I don't know how we do it, but we do.
Okay. That's amazing. And are the people in your group all pediatric emergency care researchers, or are they of all different backgrounds, of all different interests?
So I'm not going to lie, I totally tagged on to the pediatric hospital medicine writing group.
Okay.
So mostly they're hospital medicine. There are a few of us now that have tagged along that are emergency medicine as well.
Okay, so you tapped into a group that you knew existed, and you knew somebody in the group who was having a good experience.
Exactly. And they've welcomed us nicely.
Oh, that's nice. So if other people say, oh, my department doesn't have anything like that, or I'm the only early career researcher, there are groups around
They're
in another department or division you found?
First of all, there are groups around in another division. Second of all, it doesn't take a lot to start one of these groups. So if you don't have a group,
You can
call
make a group.
phone a friend. Actually, a few people from CFSP are going to start doing it on Tuesday afternoons from our program, because someone sent around an email and said, I need to start writing. who's willing to write on Tuesdays after CFSP. And so we're going to start a writing group there as well in the new year.
That's awesome.
Yeah, maybe I'll get double the productivity.
That would be wonderful. Any other, it sounds like you have delineated time, accountability, community, a plan.
Mm-hmm.
What about the issue of, for a grant, not a manuscript, you do need other people to look at your things. And it's such an iterative process. How do you manage that part if, your time is this one moment, but you need other people?
Absolutely. And grants are also more complicated because they have to go in earlier. And I like to have things in earlier than they need to go in. So that's also a few weeks earlier. And then what complicates that too is that people need enough time. You have mentors and people who are helping you that need the time to read through things. What I try to do is work on different pieces and then make sure that I'm not sending the same person every single piece. Mm. So for example, I don't need every single person to read the career development section. And I certainly don't need them to read it every time. I don't need every person to read every iteration of the specific aims. So I'll work on my specific aims, send that out to who I want to send it out to, and then start working on another piece and send that out to somebody else. Mm-hmm. It's also very important for me to have that whole list from the beginning of what I need to get done for my K and put dates. And those dates are for the first draft. And I had those ready. I had that paper ready months ago. I probably had it ready in January for a June submission, just so I knew I was keeping on track with all the really big things I had to do. And I think the last thing that was very helpful was to make sure that I gave myself at least a couple of weeks at the end to do all those little side papers that you forget about, the kind of the human subjects and all the dissemination plan. All those things, even though they're small and it's not what we work on most of the time, they do take time and they are read. And so I just made sure that when I gave my last draft out to my mentors and people who were reviewing the grant, in that time I left myself 3 weeks to work on all those other papers.
That is so smart. I'm sure you avoided a lot of last minute disasters because, as you say, especially for a career development award, the additional sections beyond your aims and your analysis, and then there's the career development plan and training plan, but all the front matter, all the letters, all the bio sketches, I mean, it just takes so much time, and that can be a real gotcha moment for people who don't really appreciate what is involved.
It is, and then if you don't do it, that last second when you're doing it, you don't have the time to really look over and check that your margins are right, or that you've gotten all the reference letters on 1 page instead of 1.5 pages. So all of those little things that I was able to put everything aside for a few days and then take a look at it with fresh eyes, reread the whole thing, make sure all those little things were done was really important. And just actually mentioning that, the last day, I remember this was my last scholarly working group. I printed out my entire grant cover to cover, including the career development plan, the research plan, the bio sketches, the letters. I printed them all out and took a red pen just so I could really read through and make sure my language was consistent, my aims were consistent across pages because those change so often, and really went through with a red pen over the whole thing, that the bio sketches had my name on them. And so that was really helpful. I had to make quite a few edits after making those changes. So that was a nice thing to do at the end after putting the grant aside for a couple of days.
That's a great suggestion. I agree with you. I have even gone so far as to, with one of our recent scholars, insist on a calendar appointment for when he could put aside his draft and when he could look at it again. And we calculated how many days he had to spare. And I said, do not peek. You are not allowed to pick at it. You cannot look at it until that calendar goes off. Do something else. There's a million other things you can do on this grant. Stop trying to mess with your sentences, because if you let it go, you'll look at it with fresh eyes. Yeah. And you did a step beyond, which I have to do too, which is print it on paper. There's something about looking at it on a screen and looking at it on actual paper that's different, and you will see mistakes that you will miss on the screen. So it's really, really helpful.
I corrected a lot.
Yeah. Shocking, right? Yeah. Okay, thank you so much, Maya.
Of course.